Alright, so for the next drug, which we'll be talking about is pharmacology this evening, is Biapenem. So we'll talk about the pharmacology of Biapenem. So for the Biapenem, you could actually see the drug. Okay, you can appreciate it from here. Okay, so this one we said that is a Carbapenem. Okay, antibiotics. So it has a broad spectrum of activity. It's used in Asia to treating a lot of bacterial infections, right? So mechanism of action, just like other penicillins, it will basically kind of like stop the bacteria from forming a very good cell wall. So the bacteria will now be predisposed to all types of attacks, right? So it will lead to cell lysis, that's breakdown of cell, and also death. So it's bactericidal, that means it will basically what? Kill the bacteria directly. Okay, so spectrum of activity has a potent activity against gram-negative organisms like Enterobacterials, Pseudomonas aeruginosa, Acinetobacter baumannii, as well as gram-positive bacteria like Clostridium and Bacteroides. Okay, so resistance is low. Okay, so most organisms will be susceptible to it. Okay, Biapenem. So pharmacokinetics, absorption, they give it intravenous, okay, because if we give it through the oral route, the amount of it that will be reaching the system is very, very low. Okay, so distribution, there's a 2-compartment model with good tissue penetration. Metabolism, it will be stable in the presence of renal brush border enzymes. Okay, excretion, it will be excreted unchanged in urine. Half-life is short. Dose optimization, so studies suggest that a regimen of 600 milligrams every 6 hours will be more effective than 1.2 daily dose. Okay, so resistance is not a substrate for bacterial efflux pumps and has a lot of stability. Okay, so resistance can still emerge, okay, that's later on, but for now the drug is very effective. Okay, so clinical use is used mainly in treating pneumonia, septicemia, complicated urinary tract infections, pyelonephritis, peritonitis, then also infections that are basically from respiratory conditions. Okay, so this is it for Biapenem pharmacology.